Thank you so much for inviting me to speak about this very important and relevant topic, I think. Because we, as doctors, we all know how to treat our patients, but we don't know how to treat ourselves a lot of times. But does this, besides treating ourselves and seeing that we are in good shape, does this improve our patient care also? Let's see what we can do about it. Thank you, Dr. GVK, for inviting me to give this talk. So the opening thought is we cannot deliver optimal care from an exhausted mind. If our mind is exhausted, how can we actually deliver good care? Why does this matter? This matters because burnout rates among physicians are about 44% globally. And Indian doctors, we have very peculiar problems. We see about 200 patients on an average. There's always a competition, 20 patients, 30 patients, 40 patients, 50 patients, 100 patients, how much OP, how much IP. It always is that the numbers are what keep on increasing. So we always are working for a very high patient load. And then besides us, there's a lot of resource constraint, because not only are we seeing the patient as a doctor, we are doing some counseling, we are doing some education, we are doing some other things also. Because the patient brings all their burdens to us to tell us a lot of things, whether, whether their family, there is some problem, there is an issue. So we have to learn to listen to all these things. Then the emotional, okay. Okay. So then the emotional burden which is there, because we as are humans also, in our houses also, whether it's our parents, our spouse, our children, our brothers, sisters, somebody, some problems are also emotionally happening. So all these emotional there are a direct impact on the patient safety. So what is physician wellness? Physician wellness is physical health, mental health, emotional resilience, professional fulfillment. These are all very important things. And what is burnout? Burnout is emotional exhaustion, depersonalization, reduced in the personal accomplishments. And this is prevalent in about 40 to 70% of patients who report burnouts. And this is, of course, more higher in frontline specialties. A lot of times we have very high patient loads, very limited consultation time, and because of this we find that violence against doctors is also increasing. The burnout causes are the long working hours, sleep deprivation, administrative overload, because not only are we seeing the patients, we are also managing the administrative ends of our nursing homes and things. So emotional fatigue is there. The warning signs are irritability, there's reduced empathy, decision fatigue is there, sleep disturbances are there. So there's this study which was done by American Medical Association, which found that 51% of the HCPs, they endorsed and they experienced burnouts. The highest rate of physician burnouts was in family medicine. So family physicians, oncologists, those who deal with critical care, these are the people who had high incidences. So what is the impact on patient care? There's increase in medical errors, there's reduction in physical satisfaction. In today's times, most of our patients, the minute they finish the consultation, go out and write us a Google review. So that is also something which is, which plays on the minds of us. The quality care reduces and the burnout keeps increasing. Besides this, the chronic stress leads to increase in cortisol. There is, this leads to impaired attention span and poor decision making. So let us see the lifestyle medicine framework. This is the evidence-based root cause approach, and it applies not just to our physicians, like how we heard Dr. Arvind Gupta speak about, but this also applies to us, structured around 6 core values. So the first is nutrition. We all know that we all eat erratically during the weekdays. When we are seeing patients, most of the time we barely have time to grab a bite. Late night dinner is very common. High refined carbs is what we eat. Fatigue and insulin resistance. And then weekends we have a conference where again we are having high caloric, high fat foods. So these are things that are there. But what is important is that stable nutrition, this improves the cognition and the energy. So take a case of a 48-year-old endocrinologist post-lunch fatigue because, all the time he's eating very high carb food, the post-lunch, a lot of drowsiness, but still he is continuing to see patients. There is central OPD. Regular OPD meal skipping is there also. And so, but if there is a structured meal planning and protein balance, as we just heard, so increase in protein consumption, fiber consumption, that improves. Then we heard, then physical activity. More than 50% of the Indian doctors are physically inactive. They are sitting in OPDs for long times, extended times, sometimes 3 to 4 hours together at a stretch they are sitting. They do not move, they are not consuming calories, they are not, doing then neat exercise, neat whatever movements. Agreed, it is advised 150 minutes per week. This reduces the burnout and improves the sleep also, the exercise that is there. Otherwise, we have other issues to deal with. We heard about the liver fat and all those other things. What is very important is the restorative sleep. A lot of times we heard that we need at least 7 to 8 hours of good sleep. But do we achieve that amount of sleep? Also, the sleep quality matters as much as the duration. You need to have uninterrupted, refreshing sleep. This is more important than just the hours. So you take a case of a 50-year-old obese physician. He has complaints, his partner complains that he is snoring in the night, he is very tired when he wakes up. He wakes up in the middle of the night and then finds it difficult to fall asleep. He has undiagnosed OSA and poor glycemic control. So besides this, the key markers of good quality sleep is that you fall asleep within the next 20 to 30 minutes after lying down. There's minimal nighttime awakening, wake up refreshed and energized, and there is alertness through the day. So what are the physiological benefits? There's an improvement in the insulin sensitivity, glucose regulation, and this supports the cardiovascular health. There is an improvement in the immune function as well as the hormonal balance, especially the melatonin, the cortisol, growth hormone. So the science of sleeping is that we are all in a state of chronic sleep debt. This slowly impairs our cognition, and disrupted REM sleep, this affects the emotional regulation. Besides this, the fragmented sleep, because a lot of times we are woken up in the night by calls from our patients or things like that. And this leads to fragmentation of our sleep, and sympathetic drive increases. So because of this, there's a higher risk of diabetes, obesity, hypertension, increase in the cardiovascular events and stroke, anxiety, depression, cognitive decline, daytime fatigue, and reduced quality of life. With age also, there is a reduction in the slow wave deep sleep. The melatonin production is lower, and there is more frequent nighttime awakenings. And also, we tend to get up a little more early in the morning. So the practical strategy to maintain that is maintain a constant sleep time, especially on weekends also. Limit the daytime naps to 20 to 30 minutes, and definitely the nap should be before at least 6 hours before your bedtime. Avoid screens or no screens at least 45 minutes before you sleep. The environment that you sleep should be dark and cool, and regular physical activity is what you must engage. Also, another thing is that what we do is we tend to sleep a little more on the weekends, so as to catch up, which is okay, but the thing is that hampers your sleep in the long run. Ideally, of course, these days devices are available that you can track your sleep and maintain a good sleeping hygiene. So another thing is that we as doctors have duty hours, or in the night we are seeing patients. So at that time you should take a strategic nap, avoid heavy meals. When you know you're going to be on call, avoid taking a heavy meal. See to it that you're well hydrated and you have a good electrolyte balance. As well as post-call, you should have some time wherein, just relax and do some decompression. So this person who we saw took CPAP, he was diagnosed with OSA, improved the sleep hygiene, and his cognitive recovery was there. So therefore, persistent non-restorative sleep warrants evaluation for OSA. If that is possible, you can have it evaluated. GERD, hypertension, depression, anxiety, a lot of times polypharmacy. Environmental disruptors are there, like noise, sleep, light, maybe the temperature, if it's like very hot, you are not able to sleep. So all these things need to be taken care of. Then comes stress management. Stress is something that we all live with, and I think some amount of stress we all enjoy having. But chronic stress is a problem. There is a lot of injury, moral injury, decision fatigue occurs with that. So we need to have some mindfulness and some boundaries we need to set to reduce the burnout. So in the long run, of course, exercising, eating well is important, and mindfulness is something that we need to practice. Besides that, we need to also improve our social connection. The other pillar is social connection. Medicine is very emotionally demanding. We all have a high cognitive overload, because when you're seeing so many patients, it's very difficult to remember what is happening with each patient. And sometimes they will suddenly call you and say, okay, doctor, do you remember I came to you? How are you supposed to remember all this? But still, to maintain social contact, you will, yes, okay, tell me more. Sometimes those things are there. So what is very important is that avoid emotional exhaustion. Social bonds are very important. You must have meaningful connections, good relationships with your family, with your friends. Have a good circle of friends. That's very important. This reduces the burnout, anxiety, and the depressive symptoms. So physicians with stronger peer and family support, they are able to have better, lower emotional exhaustion, greater professional satisfaction, as well as higher resilience during crisis. So take the case of this senior diabetologist who post-COVID had a lot of emotional exhaustion, and because of COVID there was a lot of isolation which was there. So reduce the stress hormones by having a good social support system, improve our sleep quality, as well as supporting of the mental health. This decreases the risk of depression, loneliness, compassion, and fatigue. And this improves your cognitive performance. So the impact on the professional practice is that the improved patient care is there. If you are happy, you are socially well connected, you have a better communication, you have higher empathy, as well as there's improvement in the patient trust and adherence. There's a stronger professional identity, peer networks reinforce your purpose, values, as well as the meaning in medicine. This reduces the medical errors also. So the practical strategy is protect your social time. So see to it that if you have a good social circle, make time to meet them. So you need to clock it into your diary that on such and such date at such and such time I will go out for lunch with or dinner, whatever it happens. Or you not just have a cup of coffee with your friends. Maintain a regular peer checkup. Do call your friends on and off on a regular basis to see how they are, to discuss things which are happening, and normalize a conversation around stress and failure and vulnerability. It's not very bad to talk about these problems, as well as limit the digital isolation. A lot of people are only connected with their phone. They only are sending messages on WhatsApp, forwards and all. That can be limited and increase your face-to-face connection. So this person improved with peer group and mentoring and restored purpose. So the clinical take-home message in this is loneliness is a silent risk factor for physicians, the burnout and the poor health. Social connection is not a luxury, it is preventive medicine. A connected physician is more resilient, compassionate, and an effective healer. So now the other thing we come to is addictions. There are a lot of addictions which happen. There are many, many different types of addictions. And what is the new addiction is the digital addiction, besides the nicotine as well as alcohol. Why are we as physicians vulnerable? Because of the increased stress in our lives, the easy access to substance, the emotional fatigue, performance pressures, and erratic duty hours. So what are the warning signs? The increased tolerance to the substance, the irritability during withdrawal, and what is different is the secretive use. They are all started with coping with stress, but then this leads to further problems. So instead, what can you do? Instead, exercise microbursts can be there. You can just walk around in the room every 1 hour or so in between. Deep breathing cycles, so there peer emotional check-ins, short mindfulness. Again, just give me 2 minutes. So, and what's very important is avoid the stigma of seeking help. If there is a problem, seek help. So this is what physician burnout looks like, right from chronic stress to cardiovascular diseases. All the various things lead to all these problems. We need to improve on this because it improves our clinical judgment as well as the patient safety. The impact, like I said, it affects the system, it affects not just us, it affects our patients also. Also, we as, we glorify that we work for so many hours and we have less time to sleep. This is something that we need to change. We have to see to it that we look after ourselves, have our meals on time, sleep on time, because this all will lead to a problem. And if you're going to create a team and teamwork, so this, you need to see to it that self-care is a professional responsibility. We need to see to it that we have sustainable care. Also, we always have the thing of patients first. We always look after our patients first. We forget to look after ourselves. So this is a simplified chart in which yes, I thought let's use ChatGPT to create a message. So the simple things is that eat well, move well, sleep well, manage the stress, see to it that you maintain social connections and avoid risky substance. So the closing thought is that physician wellness is not a luxury, it is a clinical necessity.